Good, happy Wednesday evening, December 16, 2020. I'm Riley King, and welcome to the Riley King Newscast, right here on the Riley King Network. We have a lot of news to get to this Wednesday evening, so let's begin. First up, we begin with COVID-19 updates. 21 COVID-19 deaths announced in deadliest day in New Hampshire since the start of the pandemic. State sets new record for highest number currently hospitalized. 21 more Granite Staters have died of COVID-19, a single-day record, state health officials announced today. And now let's take a look at your COVID-19 New Hampshire COVID information, new updates and data. Let's take a look at that right now. And here is a look at that information for all of you right now. There are 33,433 number of people in New Hampshire have tested positive for COVID-19. 16,873,988 number of people in the United States have tested positive. 625 number of deaths from COVID-19 in New Hampshire. 870 number of people have been hospitalized with COVID-19 in New Hampshire. And 306,243 number of deaths from COVID-19 in the United States. Now let's take a look at this map of New Hampshire where current cases of COVID-19 are. In Nashua, 459. Let's take a look at this map of New Hampshire where total cases of COVID-19 are. Nashua, 2941. And now let's take a look at these three charts here. Let's start with the first chart here. New cases each day in New Hampshire in the purple. Daily new positive COVID-19 cases. Orange, new hospitalization, and red deaths. Let's take a look at this chart here. Current cases in the purple, current COVID-19 cases, and in the orange, current hospitalization. Let's take a look at this chart here. Total cases in the purple, total positive COVID-19 cases, orange, total hospitalization, red deaths, and blue recovered. Let's take a look at this chart here. Positive PCR test rate, positive PCR and antigen test rate, and daily PCR test. Let's take a look at this chart here. Age group of cases, and female and male of cases. Let's take a look at this chart here. Infections, hospitalizations, and deaths. Let's take a look at this chart here. Deaths, percent of New Hampshire population, race/ethnicity of cases, and hospitalizations. And a reminder, your common symptoms: fever, lack of smell, cough, chills, difficult breathing, nausea, vomiting, and diarrhea. How it spreads, and prevention tips. And be sure to stay with the Riley King Network for the latest of your COVID-19 information. New Hampshire prepares for heavy snowfall. Drivers urged to stay home during Thursday morning commute. Let's take a listen to that video from WMUR News 9, Ray Brewer.
It's the Sale of Sales Savings event featuring Chevy employee discounts for everyone at Bentley Chevrolet. Buy a new 2020 Chevy Equinox all-wheel drive SUV, Bentley Chevrolet, the neighborhood dealer who treats you like family.
At the Manchester Public Works Department, preparations are underway for the winter storm tomorrow that could dump more than a foot of snow in parts of the state. The department is expecting to start calling in personnel around 3 o'clock in the morning.
We're going to have anywhere between 40 and 50 pieces of equipment out there on the streets. We encourage people to minimize their travel to only that is necessary.
It is a similar message from New Hampshire DOT, as the timing of the storm is expected to have a severe impact on the morning commute.
It's expected to be a dry, fluffy snow, but nonetheless it's blowing, and visibility will be so poor that it really is safer to be at home.
And the expected intensity of the snow bands means drivers can expect to deal with snow-covered roads.
And anyone who has the opportunity to telework tomorrow or to otherwise stay home, that they do so based on They're reporting potentially more than an inch an hour during that commuter time.
In Keene, they're expecting about 8 to 10 inches of snow, adding their equipment is ready. While Manchester and New Hampshire DOT are not pre-treating roads, in Keene, they are using a special salt they refer to as magic.
It's treated with a derivative of the brewing process, and the salt is actually coated with this and allows the salt to work at lower temperatures.
And they are expecting to catch a break in this storm, especially compared to years past.
Much fewer people are commuting these days due to the pandemic, and also the schools, being remote right now.
So far, New Hampshire DOT, along with Manchester and Keene, say COVID is not having an impact when it comes to their personnel on the plow crews, but they're keeping their fingers crossed that continues to be the case. Reporting live in Manchester, Ray Brewer, WMUR News Now.
Okay, and there you go on that video and that report. Manchester buildings struck by gunfire, police say. No one hurt in shootings. Let's take a listen to that video from WMUR News 9.
It's the Sale of Sales Savings event featuring Chevy employee discounts for everyone at Bentley Chevrolet. Buy a new 2020 Chevy Equinox all-wheel drive SUV, Bentley Chevrolet, the neighborhood dealer who treats you like family.
Right now, Manchester police are investigating after 2 buildings were hit by gunfire. Police say they received reports of gunshots heard in the area of Beach and Hayward Streets before 10 o'clock last night. They found shell casings, but say the suspects took off. Police say no one was injured in either of the buildings that were hit.
Okay, and there you go on that video and that report. Authorities identified 2 people found dead in Manchester apartment Monday. Officials report no threat to the general public. Let's take a listen to that video from WMUR News 9, Kristen Carosa.
It's the Sale of Sales Savings event featuring Chevy employee discounts for everyone at Bentley Chevrolet. Buy a new 2021 Chevy Silverado 4x4 double cab pickup, Bentley Chevrolet, the neighborhood dealer who treats you like family.
The Attorney General's office says officers from the Manchester Police Department responded to 1345 Bodwell Road after receiving a 911 call. Once inside, they say they discovered 2 deceased bodies.
Those people have now been identified as Mercedes Tremblay and her son, Mason Tremblay.
Investigators say Mercedes was 25 years old and Mason was 2.
Today, autopsies were conducted on both of them. The medical examiner has determined that the cause of Mercedes' death was a single gunshot wound to the head, and the manner is still pending further investigation.
As for Mason, investigators say the cause and manner of death are still pending.
It's not uncommon that sometimes further investigation, both from the police department and from the medical examiner's office, is necessary to accurately determine the cause and manner of death, and this just happens to be one of those cases.
Officials are asking anyone who saw Mercedes or Mason since December 6th to contact the Manchester Police Department Detective Unit.
Contact, interacted in any way with either these people or maybe that residence, that would be very helpful.
In the meantime, officials say people in the area are safe.
We're always assessing any threat to the public, and based on the information that we have to date, there doesn't appear to be any threat to the general public.
The Attorney General's office is working with the Manchester Police Department to solve this crime. Once they have more information, they will release it. Reporting in Manchester, Kristen Carosa, WMUR News Now.
Okay, and there you go on that video and that report. Rawson reports, will we still have to wear masks after vaccination? Let's take a listen to that video from Rawson reports.
It's the Sale of Sales Savings event featuring Chevy employee discounts for everyone at Bentley Chevrolet. Buy a new 2021 Chevy Silverado 4x4 double cab pickup, Bentley Chevrolet, the neighborhood dealer who treats you like family.
Hey, yeah, it's been amazing to watch, right? Those frontline workers getting the vaccine finally. But I know many of you out there are still not convinced the vaccine is safe. You're worried about political pressures, and also getting anything new shot into your arm can worry you. Let's get some answers here from a man who would know. This guy would know. Dr. Paul Offit, the director of the Vaccine Education Center at the Children's Hospital of Philadelphia. Dr. Offit is also a member of the FDA Vaccine Advisory Committee. And Dr. Offit, you have looked at the data, the trials. In your role on the FDA Advisory Committee, you voted yes to approving the Pfizer vaccine. You've always been a straight shooter with us. We talked a lot over the months. So is it safe? What's the bottom line?
Well, what you know is you know that these vaccines, Pfizer's and now Moderna's, have been tested in tens of thousands of people and haven't been shown to have a serious side effect in, that you could say now is relatively uncommon. Now, that doesn't, 10,000 people is not 10 million people. And I think when these vaccines roll out, you want to make sure that it doesn't cause a rare, serious side effect. So right now, the question I think you have to ask yourself is do we know enough? Because you never know everything. Do you know enough to say that this vaccine's benefits appear to clearly and definitively outweigh what at this point are theoretical risks? And I think the answer to that's yes.
Are you going to get one?
Absolutely. I can't wait to get one. I just emailed the person at our hospital saying, how come I'm not higher in the list? I mean, I'm going to be on service next week. I'm going to be seeing patients that potentially have COVID-19. I would like to get my vaccine, yes.
All right, well, it says it all. All right, so I get this vaccine. It prevents me from getting COVID, hopefully, Pfizer 95%. Does that also mean I'm not a carrier and I can't infect other people who may not have been vaccinated yet? Or is it just I won't get sick from it, but I can still spread it?
That's what it means. It means right now that we know that the vaccine can prevent disease, but we don't know whether or not it can prevent infection, in which case you could still have no symptoms, but still be shedding virus and be contagious. Those studies will be done early next year. I was just on a conference call yesterday with an NIH group. They're preparing to do those studies. It sounds like they're going to do them on college campuses, and I think we're going to have that answer early next year.
Got it. So for the time being, we're going to move into a spot where maybe over the summer where you have the groups that were vaccinated and weren't, and they'll be in different risk categories then.
Exactly right. So I think everybody who's vaccinated should still, wear a mask, social distance, because you still may be contagious to others when you're exposed to the virus. So you're doing that for your neighbor, assuming, you care about your neighbor.
Let's talk about the timeline here. When can my parents get it? Senior citizens, no real underlying conditions aside from being senior citizens. How do they find out it's their turn? Do they get an email or something? How do they know to go?
Right, so they would be in the third tier. So the 1A tier are people who live or work in long-term care facilities or are healthcare workers. The 1B tier, second tier, are people who are other essential workers: transportation, utilities, law enforcement, pharmacies, grocery stores, etc. And then the third tier are people over 65 or people who have certain medical conditions like obesity or diabetes, type 1 or type 2 diabetes. So those groups are the third group. That probably comprises about 150 million people. Dr. Fauci thinks we can get to then that next group, the general population, by April. I think that's really optimistic. I would be surprised if we could get there by early summer, but hopefully by the middle of next year anyway.
Dr. Offit, thank you so much, as always, and for all your work on the FDA Advisory Panel, too. We're going to keep answering your questions here on TV and online. Head to RossonReports.com. Sign up for my newsletter. We have breaking details on your health and your money whenever something happens, and we break it down, boil it right down for you, what it means for you. Back to you.
Okay, and there you go. And that does it for this evening edition of the Riley King Newscast right here on the Riley King Network. Thank you for watching this evening edition. Have a great rest of your evening. See you back here tomorrow for another newscast. I'll have a news report coming up in a little bit. Good night and goodbye, everyone.